Welcome to the podcast of the American Journal of Psychiatry, Residence Journal. I'm Dr. Badar Ratnakran, and I'm a second-year resident at Carolian Clinic, Virginia Tech Carolian School of Medicine in Roanoke, Virginia. I'll be serving as a guest editor for the Residence Journal on the theme of Psychiatry and Visual Arts. You might be wondering why we chose the theme of Psychiatry and Visual Arts. Well, arts has been around since the time of mankind, and various art forms like paintings, movies, dance have all been not only a form of entertainment, they have been a media for expression of oneself and creativity. Various themes have been depicted in arts, including religion, human rights, culture, and the way these themes have been depicted depend on how our society views them. Human emotions and behavior have been popular themes, including mental illness. And in visual art forms like paintings and films have depicted various topics related to psychiatry like treatment, stigma, caregiver burden. And some of the famous examples include the famous painting called A Rake's Progress by William Hogarth that depicted an asylum in 18th century at the Bethlehem Royal Hospital, to the recently released Beautiful Boy that explored the relationship between a father and the son who was struggling with addiction. To speak more about this, I have the distinguished Dr. Dinesh Bugra from the United Kingdom. Dr. Dinesh Bugra is the Emeritus Professor of Mental Health and Cultural Diversity at the Institute of Psychiatry and Psychology, Neuroscience at the famous King's College of London. He has received the Commander of the Most Excellent Order of the British Empire. He is Editor-in-Chief of International Journal of Social Psychiatry and International Review of Psychiatry. He is a past president of the World Psychiatric Association, and during his time, he led the WPA Lancet Commission on Psychiatry and made recommendations on the future of psychiatry. He is the former president of Royal College of Psychiatrists in the UK. He has written over 30 books, 90 book chapters, and has written over 200 peer-reviewed articles in journals. His areas of interest include social and public psychiatry, transcultural psychiatry, education psychiatry around the world, administration leadership in psychiatry, stigma, and mental health. And apart from all this, he has a keen interest in psychiatry and the arts. He has written a book called Mad Tales from Bollywood. Bollywood is a huge film industry in India based on Hindi cinema. And he has written multiple peer-reviewed articles on arts and psychiatry and has developed modules and courses for medical students and trainees on psychiatry and cinema. With this, I welcome Dr. Bugra to our podcast. Dr. Bugra, thank you for joining us.
Thank you very much.
So start with, could you share with us how you got interested in this field of psychiatry and arts?
As a medical student back in India, and in the early 70s, I was always interested in films and also literature. So kind of reading quite a lot then and now, and watching films. I remember many days during my medical school time when we would go out and see 4 or 5 films a day. So it was quite interested in how you see something visually, and I think one of the interesting things is that same thing can create very different impressions in different people's minds, depending upon their cultures, depending upon how they interpret what is being shown, whether it's in a film or in a painting. And one of the big challenges really is that if you look at the art itself, there are 2 ways. One is that artists who have painted and have had mental illness themselves, like Van Gogh, how they see the world when they're unwell and how they see the world when they're well is quite an interesting observation. And the second interaction between art and mental illnesses, people who have mental illness, who use art therapy, for example, to make sense of their delusional, hallucinatory experiences and try and make sense of the external world.
Okay. I have been to your workshop on leadership skills in psychiatry, and I have seen you use paintings to send a message on how people perceive certain objects or scenarios. Do you have any famous paintings related to mental illness, and could you tell us why?
I think that, there are quite a lot. You mentioned Hogarth and his work, and there have been others ever since. I think for one of the interesting paintings that I always get back to is Scream by Munch. That was the period when he was obviously feeling unwell, trapped, and that showed his inner turmoil and inner world, and that's why it's called the Scream.
Yeah, yeah. Even now, that painting has a lot of relevance in our current popular culture, as people are using it for memes and troll images.
Yeah.
Yeah. Uh, as we discussed, one of your important works is that book, Mad Tales in Bollywood. I heard stories that you received funds from Wellcome Trust to write it. Could you share with our audience on what motivated you to write it and how did you write that book?
I think there were sort of several things which interested me. One was that the question really is whether, cinema affects society or society affects cinema. And quite often, when I've had conversations with various filmmakers, producers, directors, quite often they tell me that they make movies to make money and entertain. They're not really looking at education. And what got me interested in was the relationship between social attitudes to mental illness and how mental illness is portrayed into films. And what I looked at films from 1950 to 2000 and divided that 50-year period into three rough stages to compare what social attitudes were like. So immediately after the partition of India and independence, there was quite a lot of sense of enthusiasm, idealism. Democratic institutions were being established, and there was a much more constructive way of doing things. Say, quite often the heroes would be doctors or the heroines would be doctors, teachers, heroes would be engineers. So it was all about construction of a new society and a new country. And so the films that I located during that period were the ones where although, sometimes mental illness was shown as a figure of fun, sometimes it was shown as, object of pity and so on and so forth. By and large, the portrayal was quite positive, and there were 2 or 3 excellent films which use psychoanalysis as a way of trying to explore. Again, one of the things that we have to bear in mind is that films are like psychoanalysis. So you're seeing something, and 2 people seeing the same scene or same film might see different things depending upon what you're looking out for. And the second era, from about 1970, 74 to about another sort of 15 years or so, was very much period of turmoil when Mrs. Gandhi, as Prime Minister, declared emergency and civil liberties were cut down, opposition leaders were imprisoned. And during that time, there was a tremendous amount of illustration in films of psychopathy, where heroes were being very psychopathic, sociopathic, had no kind of control. So that made it quite interesting. And then the sort of third period was very much when the kind of political scenario changed and you got a nationalist Hindu government. So there were films with mental illness where the treatment was shown to be Ayurvedic system rather than Western allopathic system. So during these kind of stages, I mean these are arbitrary stages, and I'm not saying that I looked at every film that was produced or shown during those 50 years, but there were sort of illustrative examples which kind of confirmed the hypothesis that there were issues related to the social factors which influenced how mental illness was portrayed and illustrated and dealt with in films in a number of levels.
So, as you said, many of the films did show some negative or stereotypical portrayals. Mental illness has been in movies for a long time. If you take from 1948, there's a famous movie called The Snake Pit. And later on, there was a movie called One Flew Over Cuckoo's Nest. Some of those movies had not done justice to the portrayal of psychiatry or mental illness. But even still now, we keep on having films that portray psychiatric disorders or mental illness. Do you see any recent changes or trends in the portrayals?
I think certainly in the last decade or so, there have been quite a lot of interesting films, and particularly, again, that's a sort of reflection of the social change because India now has, multiplexes rather than single cinemas. So multiplexes means that you can have a range of audiences from 100-seater to 500 or 1,000 seaters. And recent films have tackled things like Alzheimer's. They've tackled things like conduct disorders and also autism and Asperger's, and there's a kind of range of conditions beginning to emerge, which wasn't the case 20, 25, 30 years ago. So that again reflects that because the society has changed and there are people who are much more aware of mental illness, and therefore there is a recognition by the writers and directors and actors to sort of invest in that.
Have you seen any such trends in Western cinema?
I think even within Western cinema, I think that there have been some very good portrayals. The two films that you mentioned, apart from that, I quite often use Hitchcock films to teach medical students about psychopathy. So, Strangers on a Train is a perfect example. And, recent Talented Mr. Ripley is again, what you have to sort of see is that these are films, whereas if you read the book, that shows something quite different. And therefore, there is a tension between commercial production and accuracy. Again, to be fair, there have been some really interesting films. For example, Ordinary People, which is about a counselor. But then within that film, there are problems that there are no boundaries between the counselor and the patient. And similarly, there have been many other films that quite often, some are really bad and some are really good in the sense that they're realistic and they portray what it means to have mental illness. But for me, I think one of the other interesting things about films is that how others respond to people with mental illness, so their family, their friends, which you can see in a film. Whereas if you're assessing a patient for an hour every week, or even if it's every day, the rest of the time they're somewhere else, and therefore you get a very different perspective because you never know how their carers or family are responding to their needs.
Having said that, have you ever noticed any difference in how mental illness is portrayed in Western cinema versus cinema in other cultures?
I think it again sort of reflects. As I said, the film based on John Nash's life, was an interesting film, and there was a film on bipolar illness, which was again very interesting and very well done, and I can't remember its name. But there are, specific issues related to the West and the East and how these things are dealt with.
Now, you developed modules and short courses on psychiatry and cinema. Many residency training programs across the world use movie clubs and cinema education psychiatry. Do you feel that the popularity of them has gone down? Is there any relevance in our current scenario of training?
I think it's important in current scenario to include humanities and arts for a number of reasons. I mean, the most important reason is that it makes things much more interesting, much more human, and it gives the clinicians a very different perspective. So, for example, if you have a child in your clinic who's kind of showing a painting of their experience, or if they've been sexually abused, and so they can, express something by painting rather than by verbal skills. So you can then use that to open up other avenues. And equally importantly, I think it's the changes in training mean that quite often, what I do is used to show a film and just let it run for an hour and a half, 2 hours, and then ask the students to sort of, identify certain things. And if they could not, then you rewind and go back to that point and say, well, okay, what do you think now? And it is, again, the interesting thing about films, for example, is in training, is that it's not only the visual bit, but it's also the auditory bit. So what's not being said or what's not being heard makes it quite an interesting way of teaching. And, again, in the modules that I developed, you sort of select conditions. So, you have something on psychopathy, as I said. You may have something on obsessive compulsive disorders. You may have something on schizophrenia. You may have something on bipolar disorders, phobias, etc. So you can try and use a topic to illustrate the key phenomenological points so that the clinicians can then become aware and use that in their assessments.
Yes. But I always found the portrayal of phenomenology is very important in learning through films and psychiatry. In our current age, do you have any advice for residents or medical students when they try to explore psychiatry and arts?
I think it is very important to look at arts and medicine as a whole, but arts and psychiatry in particular, because it's very correlated. I mean, one of the things that makes psychiatry so interesting is that it's intellectually challenging, it's intellectually stimulating, because quite often, even when the patients are telling you something, you have to corroborate what they're saying is true, whether other people have noticed that, how other people have responded. So it's kind of corroborating history. There are very few objective tests to say, well, this is the diagnosis. And again, there are lots of sort of conditions where people can use arts to explore. So the clinicians need to be aware. And I would like to emphasize to your listeners that medicine is an art backed by science. So we need to be very careful in how we practice medicine. You can imagine if you're a child, you may be better placed expressing what you're feeling and what you've gone through drawings and paintings. Similarly, if you have dementia, you may not be able to express verbally what you're feeling, but you may be able to show it through paintings and drawings and so on and so forth. And also, it's one of the ways of keeping occupied and, working in a group with paintings, etc., which can make a lot of difference to people's social capital.
Right. So with that, there is also some warnings when you explore psychiatry and arts. With this, we come to the end of our podcast. Dr. Brugra, it has been an honor for you to have with us. And for our listeners, thank you very much.